Did you know that in the United States, someone has a stroke every 40 seconds and every 3.5 minutes someone loses their life to it? The scariest part isn't just the numbers, it's the fact that most patients had early warning signs, but ignored them. So here's the big question: are you unknowingly ignoring these warning signals yourself? In today's video, we're going to uncover the top 10 stroke warning signs that many Americans overlook. And I promise, some of these signs will surprise you because they seem so ordinary, yet they can be extremely dangerous. Let's dive right into the very first sign. The very first and most common sign of a stroke is sudden weakness or numbness on one side of the body. You might notice that your face suddenly droops, one arm becomes too weak to lift, or your leg suddenly gives out. What makes this symptom stand out is that it usually affects only one side of the body. Why does this happen? When blood flow to the brain is blocked, the part of the brain that controls movement is starved of oxygen. As a result, one half of your body may become weak, numb, or even paralyzed. According to the American Stroke Association, more than 80% of stroke cases show this sign right from the start. Yet many people dismiss it, thinking it's just fatigue. Imagine this: someone is eating and suddenly they drop their spoon or can't hold their cup with one hand. That's not clumsiness, that's a warning. Here's a common question: what if the numbness lasts only a few minutes and then goes away? The truth is that could be a TIA, a Transient Ischemic Attack. And a TIA is your brain's urgent warning that a real stroke may strike within hours or days. So never ignore this sign. And now let's move on to the next one: trouble speaking or understanding speech. The second warning sign you must never ignore is trouble speaking or understanding speech. A person may suddenly be unable to form complete sentences. Their words may come out slurred, jumbled, or completely unclear. Sometimes they may hear you but not understand, or they might respond with something totally unrelated. This happens because the areas of the brain responsible for language, called Broca's and Wernicke's regions, are starved of blood and oxygen. When these regions are affected, speech and comprehension are disrupted instantly. Research shows that more than 2/3 of stroke patients experience speech difficulties in the early stages. Sadly, many dismiss it as just stuttering or temporary fatigue. For example, someone could be chatting normally and then suddenly their speech becomes garbled or their response makes no sense at all. That's a red flag. Here's a common question: if the slurred speech or confusion lasts only a few minutes, should you still seek help? The answer is absolutely yes. Even a brief episode means your brain has already suffered damage from a transient ischemic attack, and a real stroke may be coming soon. So take action immediately if you or a loved one shows this sign. And now let's move on to the next one: sudden vision changes. The third warning sign that many Americans often overlook is sudden vision changes. You might be reading a newspaper and suddenly notice that the words on one side of the page disappear. Or when you look in the mirror, you only see half of your face. Sometimes everything becomes blurry or doubled, like you're seeing two images at once. The problem isn't with your eyes, it's with your brain. When blood flow to the part of the brain responsible for vision is disrupted, the images your eyes capture can't be processed correctly. Statistics show that about 1 in 4 stroke patients experience vision problems before or during the event. Yet many dismiss it as eye strain, stress, or simply aging. Here's a common question: what if the blurred vision lasts only a few minutes and then goes back to normal? The answer is you should still seek medical help immediately. That could be a transient ischemic attack affecting the visual centers of your brain. And that's a serious red flag. Remember, when your vision suddenly changes, it could be your brain sounding the alarm. Up next, let's look at another alarming sign: a sudden, severe headache with no clear cause. The fourth warning sign is a sudden, severe headache. Often described as the worst headache of someone's life, not every headache is dangerous. But when pain strikes out of nowhere with overwhelming intensity and is accompanied by nausea, Vomiting or dizziness, it's a red flag. This often happens when a blood vessel in the brain bursts, causing bleeding and putting immense pressure on brain tissue. The result is an explosive and bearable pain completely different from a regular headache. According to the Mayo Clinic, many cases of hemorrhagic stroke were recognized early simply because of this one symptom, a sudden thunderclap headache. Imagine being at work and suddenly clutching your head because the pain is so unbearable you can't focus. That's not a typical headache, it could be a stroke warning. A common question is, if I already suffer from migraines, how do I tell the difference? Migraines usually come with warning signs like flashing lights, light sensitivity, and can last for hours. Stroke-related headaches, on the other hand, come on instantly, hit extremely hard, and often occur with weakness or vomiting. So if you ever experience a sudden thunderclap headache, don't wait. Seek medical help immediately. Now, let's move on to another important sign: sudden dizziness, loss of balance, or unsteady walking. The fifth warning sign of a stroke is sudden dizziness, loss of balance, or unsteady walking. Many people assume dizziness is just from fatigue, low blood pressure, or getting older. But in reality, when the brain, especially the cerebellum, or brainstem, is deprived of blood, coordination is disrupted immediately. You may feel like the entire room is spinning, your body sways uncontrollably, or your steps become unsteady, almost like you're drunk. In some cases, a person might be walking normally and suddenly collapse, yet remain conscious. According to the American Heart Association, balance-related symptoms are often one of the first warning signs when a stroke affects the brainstem. Here's a common question: if I only feel dizzy when I stand up too quickly, is that a stroke? Not necessarily. That may be orthostatic hypotension. But if the dizziness comes on suddenly, is severe, and is accompanied by loss of balance, you should treat it as a potential stroke emergency. Never ignore this warning. And next, we'll talk about another serious sign: sudden loss of consciousness or unusual confusion. The sixth warning sign to watch for is sudden loss of consciousness or unusual confusion. Not every stroke begins with a headache or paralysis. In some cases, patients may faint for just a few seconds or suddenly fall into a state of confusion, not knowing where they are or what they're doing. Some may speak incoherently or forget even simple tasks. This happens because when blood flow to the brain, especially the brainstem or cortex, is disrupted, the ability to maintain consciousness and short-term memory is immediately affected. Research has shown that some strokes were first recognized only after patients fainted briefly or showed unusual confusion, even without obvious paralysis. For example, imagine someone shopping at a grocery store. Suddenly, they freeze, unable to remember what they were buying. Or worse, they faint for a moment right there in the aisle. Here's a common question: if I faint for just a few seconds and then recover, is it dangerous? The answer is yes, that could be a transient ischemic attack, often called the brain's whisper of a real stroke about to come. So never dismiss changes in consciousness, even if they seem brief. Next, we'll look at another unexpected but critical warning sign: difficulty swallowing or unusual choking. The seventh warning sign of a stroke is difficulty swallowing or unusual choking. Most people don't associate trouble swallowing with stroke, but it's actually a very serious warning. A person may suddenly find it hard to swallow water, food, or even their own saliva. They may choke or cough uncontrollably while eating, or feel like food is stuck in their throat. This happens when a stroke damages the cranial nerves and throat muscles that control swallowing. As a result, the swallowing reflex is disrupted, not only making it uncomfortable, but also increasing the risk of aspiration, pneumonia, or even suffocation. Research shows that up to half of stroke patients experience swallowing problems in the acute phase. That's a huge number. For example, imagine someone drinking water and suddenly coughing non-stop, unable to control it. Here's a common question: if I only choke when I eat too quickly, is that a stroke? Not necessarily, but if the swallowing Difficulty comes on suddenly, persists, and is accompanied by other signs like weakness or slurred speech, then it's an emergency. Remember, a simple meal should never become a struggle. And next, let's talk about another warning sign: sudden changes in behavior or emotions. The eighth warning sign is sudden changes in behavior or emotions, something many people overlook. A patient may seem completely normal, but then suddenly become irritable, angry, or aggressive. Others may swing the other way, becoming apathetic, emotionless, or instantly depressed. Some may even laugh or cry uncontrollably, a condition known as pseudobulbar affect. This happens because when a stroke affects areas of the brain that regulate emotions, such as the frontal lobe or the limbic system, the ability to control behavior is disrupted immediately. Studies show that about 30% of stroke patients experience significant mood changes, and in some cases, these signs appear in the very early stages. For example, imagine someone laughing and chatting one moment, then suddenly bursting into tears or laughing uncontrollably in a way that makes no sense for the situation. Here's a common question: if emotional changes last only a few minutes and then go away, could it still be a stroke? The answer is, if these changes occur along with other symptoms like weakness, slurred speech, or vision problems, then yes, it could be an early stroke warning. So always be alert to sudden and explained emotional changes. Next, we'll talk about a dangerous condition often overlooked: TIA, or Transient Ischemic Attack, the so-called mini-stroke. The ninth warning sign is TIA, Transient Ischemic Attack, often called a mini-stroke. A TIA looks just like a real stroke: sudden weakness on one side of the body, slurred speech, blurred vision, or loss of balance. But here's the catch: the symptoms go away within minutes, sometimes within the hour. And that's exactly why it's so dangerous, because many people dismiss it, thinking everything is fine. What's really happening is this: a blood clot temporarily blocks blood flow to the brain, then dissolves or moves away. The symptoms disappear, but the brain has already been damaged, and the risk of a full-blown stroke skyrockets. According to the CDC, about 1/3 of people who experience a TIA will suffer a major stroke within a year, and many of them within the first 48 hours. For example, imagine someone chatting normally when suddenly their face droops, their arm weakens, their words slur, and then minutes later, they're completely fine. If ignored, that person could face a deadly stroke in just days. Here's a common question: if the symptoms go away on their own, do I still need emergency care? The answer is absolutely yes. A TIA is your body's most urgent warning sign. And now, let's move on to the final warning sign: the unusual, often overlooked symptoms that appear in women and younger adults. The 10th and final warning sign is atypical symptoms in women and younger adults. Many people believe strokes only happen to the elderly, but in reality, women and even young adults can experience them, and the signs often look very different, which makes them easy to miss. They may feel sudden chest pain, rapid heartbeat, nausea, vomiting, or overwhelming fatigue. Some may complain of abdominal pain, thinking it's just indigestion. Others might have brief seizures or faint for a short time. This happens because of differences in hormones, blood vessels, and unique risk factors such as pregnancy, birth control use, stress, or modern sedentary lifestyles. When the brain reacts differently, the symptoms don't always follow the textbook pattern. Research shows that women are more likely than men to experience these unusual symptoms, which often leads to misdiagnosis or delayed treatment. For example, imagine a young woman who feels nauseous and exhausted, assuming it's just work stress. In reality, she could be experiencing a TIA or even a mild stroke. Here's a common question: should young people worry about strokes? The answer is yes. While less common, stroke rates in younger adults are rising rapidly due to stress, obesity, smoking, and lack of exercise. So never ignore these warnings, no matter your age or gender. And now, let's wrap up everything we've learned today with one powerful final message. And there you have it, the 10 critical warning signs of stroke that many Americans often overlook. Remember, stroke can strike fast and without warning, but your body almost always gives you signals ahead of time. The question is, will you recognize them and act quickly? Every second counts. The difference between life as you know it and tragedy can come down to just a few minutes. So here's my message for you. Recognize early, act immediately. That's the best way to protect yourself and your loved ones. If you found this video helpful, please hit the like button, subscribe to the channel, and turn on the notification bell so you won't miss future content. And don't hesitate to share your questions or personal stories in the comments below. I'll be here to listen and respond. In the next video, I'll be revealing the top 5 most effective ways to prevent stroke. Powerful strategies most Americans still don't know. Thank you for watching, and I'll see you in the next video.